I'm gonna close this door. Okay, good morning, everyone. Thank you so much for joining me this morning. I am Dr. Carmela Daniels, and I want to take a moment to say thank you for each of you joining in. If you have questions, please feel free to use the chat feature in order to ask questions. Maddie and I will be here to review the chat. If there's someone that you don't know in this space, please take time to get to know them. Let us know if you have any needs for accessibility during this presentation that we can accommodate you for. And this is racial equity, racial justice, and community resilience for homelessness or homeless BIPOC individuals. And I'm your presenter this morning, Dr. Carmela Daniels, and I'm going to give you a view of what the work I have done in regards to racial equity and racial justice. So thank you again this morning for joining us. Again, please use the chat feature in order to connect with either someone else or ask questions. Next slide, please. A little bit about me. I am a licensed clinical social worker with more than 20 years of experience. I also want to highlight that I have lived experience in homelessness. And for a brief moment of my life, I was homeless in the Dayton community. And so I understand homelessness from perspective of both my lived experience and then service to this community, helping veterans and those who are non-veteran or other civilians with homelessness and finding housing and securing stable housing. I've worked with the Department of Veteran Affairs for 16 years. Previously, before that, I completed racial equity, racial justice for homeless programming within the National VA Homeless Program Office. That work is very dear to me, and that is some of the work that I'll be presenting today. The rest of the lived experience will be presented in this conference presentation to help understand how we can continue to help and give resilience. Obviously, with the things that are going on in our world, it's now more than ever a time to be able to help persons who are homeless from many perspectives. So I'm a CARF surveyor also, which is an organization that does accreditation for programs to ensure that they are providing the highest level of care. I'm the founder and creator of what is called the Warmth of Leadership, which is a mentoring and consulting program that helps support those who need support in the workforce and community with getting linked to mental health services, treatment, and care. I am a contributing author to Anti-Oppressive Social Work Practice. And also, if you have not received your magazine or ordered your magazine from the National Homeless Office from this conference, please do so. I also have an article in there as well. So I welcome you. My contact information is located here on this website or on this slide, my website and my email. Please feel free to connect with me, reach out to me. Any questions that you may have afterwards, if you need someone to come and speak to your organization in regards to homelessness, if you want to debut the Evicting the American Dream, you can also request that as well. Thank you so much. Next slide, please. Our session objectives today are to examine the systemic causes of homelessness amongst BIPOC individuals and community as a whole, to understand racial trauma, to apply equity frameworks. So we're going to learn a little bit about how we apply some equity frameworks to social work, mental health, and housing practices. In this work, what we understood was that some of the scoring, some of the assessments that we were doing did not apply appropriately to populations who were diverse. We're going to also look at how we integrate community strategies, how we continue to connect with organizations and those who are there to support homeless populations and how to do that effectively. And as always, in all frames and sets of social work and advocacy, we look at how we advocate for policy reform. Obviously, if you're watching the news, if you're looking at what's been happening with the HUD, there are a lot of things that we need to be ready to act on and be ready to advocate for. And what we know that the systems that we navigate for those who are in those systems are not systems that are far removed from us as well. What we want to make sure that we understand is that we need to develop the skills to be able to advocate appropriately and making sure that policy reforms reduce racial disparities. And that may look a little different right now for us, but I think that we have a lot of work that we can still do. And there are a lot of organizations that are still out here advocating for policy reform. Next slide, please. So today, again, this is going to be an interactive conversation. We're going to do some welcome and some reframing. And I want to make sure that you feel that you're part of this conversation because, again, I don't know everything. I'm not a full expert in this area. And so please bring your knowledge base to this conversation. We want to look at the historical structural context. Again, we're going to look at the racial trauma and mental health, what this looks like as an impact of ongoing racial trauma in our community. Not only do we have an issue and a deficit regarding housing, but we also have a deficit regarding our mental health services that need to be able to be applied to those who are trying to navigate this system. Again, we're going to look at the frameworks, how we apply these things in social justice systems. We have some case studies that we can talk about, or if there are some cases that you want to discuss of how you looked at the framework for equity. We want to make sure that we understand community-led resilience models. How are we working together? How are we making sure that we have cultural humility, inclusion, and empowerment? How are we ensuring that we are doing what we need to do to meet the needs of those who need our service and our care? And then also a call of action. There's always a call of action. What are we going to do next? What can we take away from this session and the conference as a whole that is going to say, this is what we're going to be able to do. These are the tools of success that we need. This is where we want to go. And what policy recommendations are we prepared to take back to our legislative offices, to our organizations, to our council persons, people who are sitting in our civil areas? What are we prepared to bring and present to get them involved in this call of action? So that's our agenda today, our objectives and what we're going to work on. Again, please feel free to use the chat feature to ask any questions and we'll make sure we get to that. Next slide, please. And I'm sorry if you can hear that noise. There's some construction outside. Okay, so let's frame our conversation. So let's go over a couple of definitions just for the context of this conversation to ensure that we understand the language that we're using. Racial equity is the condition that would be achieved if one's racial identity no longer predicted how one is treated in society. That's essentially what the equity means of racial equity. The condition that would be achieved if no one's racial identity was a factor. If no matter what the color of your skin was or where you came from, your background, social economic status, your religious, your sexuality, orientation, if those things were not on the plate, then we would have racial equity. And it would no longer predict how we are treated, where we are treated, what services that we are eligible for, whether or not we can get moved to the front of the line or to the back of the line. If these things were removed, then we would have complete racial equity. Racial justice is the systemic fair treatment of people of all races, resulting in equitable opportunities and outcomes for all, meaning simply that it's fair. It's fair treatment, meaning that if I walk in and ask for services that a colleague or peer who may come from a different background, race, then I can come in and ask for that same treatment and we both get the same results. We're both serviced in a way that is fair. And that is the definition of what we'll be using as a definition for racial justice in this presentation. Community resilience, the sustained ability of a community to utilize available resources to respond to, withstand, and recover from adverse situations. Community resilience. So, this is collectively what we can do together. A sustained ability of a community to utilize what resources that we have in order to support those who are in need. This is important. This is my favorite framing of conversation today because we cannot do this work alone. There is no one. We have social work students who are in classrooms now working to finish their degrees to be able to come out and serve in community. Who are they going to work with? Who are they going to connect with? It requires community. Community is everything that we need. It is all that we need. And that is how we're going to continue to survive, is if we have the sustainability to utilize the resources that, whether I have everything and you have 50%, and then you bring your percentage and I bring mine, whatever that may look like. When we don't work together in community, then we cannot really get racial equity and racial justice because those things all connect. They can't stand alone. They have to be combined together. So that's how we're going to frame some of that conversation and just some of the language that we're going to use today, just to make sure that we have it. Others may have different definitions that they may see or use. Feel free to drop that in the chat. If you see racial equity, racial justice, or community resilience in a different platform or a different way, maybe it's used differently in your organization or community. Next slide for me, please. I want to highlight, if you are here on site at the conference today, that we will be premiering or viewing the Evicting the American Dream. Evicting the American Dream is on also Amazon Prime. And I have left both the link here and the image so that you can look it up. But if you're going to be here with us at the conference today, it will be shown this afternoon and it will be in the app. And you can come and view that. I'll be also doing a panel and having conversation after that and connecting with those who are here. If you would like to do this on screen or virtually later, I'm looking at also doing a showing or a virtual showing of this as well. This documentary is very close to my heart. It shows homelessness in Dayton, Ohio. It starts in the core of Dayton, Ohio, which is where I am from, and where I have both been homeless and served homeless populations in that same community. And I'm very proud of this work, that the community came together and we highlighted the needs in our community. So I encourage you, at the earliest moment that you are able, please watch Evicting the American Dream or join me this afternoon here at the conference as we show it here as well. This will highlight things that we already know about homelessness, redlining, the eviction process. It hits home for me because these are people that I know personally. These are communities and streets that I drive on every single day. And so please take time, when you have time or able, share with someone else Evicting the American Dream. And I hope to see you this afternoon also for the showing here at the conference. It is available on Amazon Prime and debuted, I think, maybe about a month or so ago. So very proud of this work. And there's other work that is also connected to the Presbyterian Church. They did work on the Flint crisis, water crisis as well. So please watch Evicting the American Dream. Next slide, please. What is also discussed in the documentary, and we're going to talk about today, and forgive me if this is a little distorted, it looks a little distorted on my screen, but redlining and segregation. When we're looking at the historical construct of homelessness, these factors still remain. In areas where those who have less socioeconomic income, where persons who are BIPOC are living, there are more abandoned buildings, more things that are going to work against community to be successfully housed as opposed to not. Even when you look at where our housing locations are, our shelters are located, many times they're not in areas where people can even catch the bus. or get to a job interview. They tend to be almost remote areas, treating sometimes like outcasts, like the homeless population is an outcast. What we know about systemic denial, if you will, or redlining is that these barriers were intentional. They were put into place in order to keep those who are more wealthy in certain areas and those who were not in other areas. And with that is the housing discrimination. Because of the redlining, then you go to the bank, you're trying to apply for a loan, you're trying to either get a loan to build a home, buy a home. Maybe you need a loan to get a down deposit for something. Based on your zip code, then they can say no. We can't service you. You're at high risk, or the neighborhood in which you live in is not flourishing, is impoverished, doesn't have enough, residual income coming in. And that continues to spread our wealth gap. The housing discrimination, what we just need to call to the room is that it's intentional. It's intentional and set up in a way that keeps persons who are trying to build their way out of homelessness or to create a better life for their families in bad situations. The wealth gap continues to expand itself. The rich are getting richer and the poor are staying poorer. We see that even more so today. Jobs being cut, prices of food going higher, things that are not working in our favor when we're looking at already a major wealth gap. We want to also look at the current disparities. If you turn on the news, then you can see everything that is a current disparity in community, your community, my community, and all over the world. BIPOC individuals are overrepresented in homeless populations. They're overrepresented in the wealth gap, meaning that they're on the lower spectrum. They're overrepresented in the housing discrimination, and they live or have housing sometimes or lack of in areas that are redlined or have been heavily segregated. In the documentary Evicting the American Dream, we discussed this redlining in great detail, showing other communities and how the redlining really hasn't changed, even after all these years. There's still areas in many communities that are redlining for school districts for multiple reasons. And when we continue to do that, we continue to support systemic barriers for those who really are trying to get ahead. I was at a restaurant a couple of weeks ago, and our server, we're just eating a regular, everyday dinner. And our server was helping us and supporting us. And it was getting kind of late in the evening. The restaurant was actually getting ready to close. And he said, we asked him, like, is it time to go? And he said, I have to be at work in the morning at 6 a.m. We thought that he meant at the restaurant. He didn't. He was a teacher, and he was saying that he has to continue to supplement his income because of the increase of prices and because his salary doesn't pay enough. And so the wealth gap affects so many people in so many different ways. And so if you don't even have a way to work two jobs successfully, or you don't have a way to get to the job, you don't have a place to live, to take a shower, you don't have roof over your head, you don't have your basic necessities met, these gaps become more and more. When I applied for a home loan to build my home, the bank that I had banked with for many, many years denied it. And I think it was because, I know it was because of the location in which I lived at that time. And I was trying to move to a different location. And for whatever the reason at that time, I felt that there was definitely some discrimination and some disparities that I faced as a woman of color, a single woman of color with two children. And so the odds are probably not in my favor for some reason because of that. And so that goes back to our framework of conversation. When we have racial disparities, racial inequalities, these are the things that continue to keep barriers in our community. So this is our historical and structural context of how we've gotten here and why many times we have stayed here. These are the things that stop us from progressing forward. Next slide, please. So, our racial disparities in homelessness. Again, we talked about this a little bit more, but let's just read some of the statistics here. And I'll read this to you. And I apologize for reading that to you, but I want to make sure we emphasize this literature and research here. Black Americans represent 13% of the general population, but 40% of the persons experiencing homelessness. And this is from 2022. I would assume because of even what's going on right now in 2025, that number is higher. We really won't know many of some of these numbers until we begin to pull the numbers and get that data at the end of this year or the beginning of next year. Indigenous persons are overrepresented by a factor of 3 to 8 times their percentage of the general population. They're overrepresented. And what I've learned from the racial equity and racial justice work that I have done is that many times when we're looking at the language that we use in homelessness, the language that we use, we want to make sure that we are identifying how the person that we're serving identifies their housing situation. What I've learned is that many times people would say, oh, she is homeless. Some persons who are indigenous or identify in that way do not consider themselves to be homeless. They consider themselves to be houseless because they consider the land, which we honor, the land as being their home. They consider themselves to be houseless because they do not have a house on that land. That was something that I really had to make sure I understood when I was working with different populations in my veteran population and how we just identify what that looks like. The Hispanic and Latino individuals face increasing rates of homelessness in many urban areas. And again, as we've said already, some of the reasons of this is because of the access or lack of access to affordable housing. In the documentary Evicting the American Dream, we talk about how many big companies, big corporate companies, these large conglomerates of banks, private entities are buying up all these houses. And they're using that as a way to help support those who invest in them and for their stock investments. So what does that mean? That means that a home that is being rented by a major corporation, as opposed to a landlord in community, can charge, of course, already we know rent is high, but they can charge a lot more. There's really no option to buy those houses. And many times they practice discriminatory practices that prevent people from being able to rent from them. And so they continue to just rent, increase the rent at their whatever rate that they want to support their stock and shareholders. And then people can't afford the rent because there is a lack of employment or increase of income. And again, the teacher who served us at the restaurant the other day, he's working 2 jobs. He may work more. Many times I work more than 1 job. And so everybody doesn't have access to that. Healthcare and social service provision. What we see now in community is that many mental health services, many mental health organizations are closing. Funding is being cut. Healthcare is at an all-time high as far as fees, things that the healthcare industry is not covering or paying for. If you become sick, you don't have any way to take care of yourself. If you don't have a backup plan, a spouse, extra income, we just left a government shutdown. There were many people who either couldn't report to work or had to report to work and were not getting paid. And that's a deficit. What we're going to see from the government shutdown is a definite increase, if we haven't already, of eviction notices, of mortgages maybe possibly defaulting. We don't know what situation people had prior to these things happening. When I was homeless in my community, it wasn't anything necessarily that I had done to become homeless. We want to make sure that we understand from a person's perspective why and how this has happened. to help serve them better. Maybe something happened that caused them to be in this situation. But we also want to understand how we can best serve them. So these disparities reflect the systemic inequalities. And these are the numbers that we have right now. These numbers are going to change. Mind you, this research is a few years old. And what we're going to know is based on the HUD changes that we saw coming out, the program cuts being done, people being cut from positions and or other things. These numbers are definitely going to increase. Next slide, please. Maddie, do we have any questions so far?
We have no new questions in the chat or in the Q&A, but if folks want to add questions to the chat, I'm happy to read them out loud during our next pause.
All right, thank you. So let's talk about racial trauma and mental health. I know there's some providers on this call. Please help me if you think there's something I'm missing here or you want to add to this conversation. Racial trauma is the psychological injury from experiencing racism, discrimination, right? So those are the things that we experience internally from things that we go through externally, and vice versa. Mental health impact, increased rates of depression, anxiety, PTSD, substance use disorders amongst persons who are BIPOC and homeless, or just amongst our homeless population in general. And working with veterans, we always had the housing first model, right? We would work with your housing first. We would, if you needed to get into substance use abuse treatment, we would absolutely do that. But it was a housing first model. We wanted to get you shelter so that you can successfully enter treatment or get a job or get employment. Healing approaches, culturally grounded interventions that acknowledge historical trauma. We want to, again, acknowledge where people are. What I spoke of about working with persons who are indigenous, they have many times identified that they are not, again, homeless, they are houseless. So we want to make sure we're using culturally appropriate language, making sure that we're acknowledging historical trauma and being sensitive to that. Access to barriers. We want to break down cultural mistrust of systems. That's going to be an ongoing process. All of these steps are ongoing. There is a lack of cultural responsive care. There is a lack of people who just care, period. And many times at the end of the day, and it sounds harsh, but it's true, someone benefits from persons being disadvantaged or being at a disadvantage or continuously being in our homeless populations. And so we want to break some of those things down. We want to make sure that we are linking people with the services that they need, but we need to understand what that mental health impact looks like and what approaches that we need to take in order to break down barriers and make sure that people are successful. Next slide for me, please. Intersectionality and homelessness works. This is Kimberly Crenshaw's framework. This is some of the framework that we use in the work that we did with our veterans. We must recognize how multiple identities and oppressions interact. We have to acknowledge that. It's not just about, oh, they're just being lazy. Oh, if they would just, get up and do more. We have to acknowledge what is breaking down in our community. We have to understand that people are discriminated against because of their race and ethnicity. That is a thing. It's not that they haven't shown up in spaces many times. It's not that they haven't tried. It is a breakdown. Immigration status. We know that that is huge in our community right now. I have friends who are teachers who are trying to protect children inside of schools. People are being ripped from their homes. There's an age and generational factor that also needs to be in there. So when we're looking at intersectionality, we want to make sure that we're creating experiences or working with persons who have unique experiences in homelessness and require those tailored approaches. In this racial equity, racial justice work, we made sure that we looked at our screening, how we were screening veterans, how we were screening persons in community. Are we even giving them the proper gender identity? Are we giving them the proper racial identity? We were finding, our research showed that people were marked as unknown. There is no one who is marked as unknown. There is no one that is unknown. People have a name. They have a race. They have a background. They come from somewhere. They are someone. It was heartbreaking to see that. What was their gender? Unknown. What was their race? Unknown. Because we didn't have the tools in place to really say or identify, or maybe the screener, the staff person, whomever took the assessment, whoever took the call, didn't get the information in depth. And so those are things that we had to look at in order to recognize the multiple things that keep persons oppressed. And so I encourage you, if you haven't looked at Kimberly Crenshaw's framework, to please do so. It has really helped me to understand and guide this racial equity, racial justice work. Next slide, please. As we go through our frameworks, continuing with that, our anti-oppressive practice, cultural humility, and racial equity impact. These are some of the work that we also did here. Recognizing power, centering the client's expertise. Again, how do you identify? Do you consider yourself to be homeless? No, I'm just couch surfing. I'm not really homeless. I'm staying at my sister's house. Getting an understanding of how they view their own situation instead of creating that for them. Sometimes you have to do the work and gather some of the data later, but be sure to do that. Make sure that we are being self-reflective and not critiquing. Addressing power imbalances as providers, as organizations, as persons who are sitting on the other side of the table. You may look at me, you may not know that I used to be homeless. It may not always be relevant to discuss in every situation, but you absolutely need to understand the power of working with those who are sitting across the table from you, working with you on the street, meeting with you on the street, that there could be a power imbalance there. You know, we want to make sure that we normalize our interactions with others. We're not normalizing their situation. We're saying that I am here to work with you. I stand equally with you. I'm developing a partnership with you to support you and meet your goals. These things are absolutely important and impactful in order to really create a framework for racial equity. Sometimes you may have to challenge your peers about the language that they use, the things that they say, encouraging them to self-reflect. We want to make sure that we understand how systemic policies affect different racial groups. Sometimes there are unintended consequences. Back to the example about the assessment tool that we were using. If a person is marked as unknown, how will we know how many persons who were BIPOC in our community that came into that center that year, if everyone was marked as unknown? That has negative consequences in the data. It can have negative consequences in funding. We need to make sure we develop a strategy to change that. And that's what we did in our racial equity work. We looked at our assessments. We changed the way that we discussed homelessness with those who we were working with, meeting with, in our COCs, all of that. It was impactful work because it challenged us to do better. There's nothing wrong with saying, okay, we need to look at this. We're doing good here, but we need to maybe look at and doing some things differently. And then we began to actually get those measures and those outcomes by race. People were being identified properly by gender and race. They were being identified by how they identify their own situation. I need support. I need a deposit. I can stay at my sister's house for 6 months. Can you help me? Can we look at how we identify the intake process and the outcomes process? So those are some of our frameworks for racial equity and racial justice. Next slide, please. So this is an example that I want to give you of work that I personally did. A homeless service provider implemented racial equity principles by conducting a racial equity audit. We had to look at what we were doing and how we were doing that. We diversified our leadership and our staff because everyone at the table shouldn't look like me. We need to have diversity at the table because we need different opinions, we need different ideas. And we need those with lived experiences sitting at those tables. How could you possibly discuss how to look at policies and procedures without discussing it about those who are affected by those same policies and procedures? Many times we work from the top down, and we really need to work from the bottom up. We need to work boots to the ground, for the lack of a better term, and then work our way up. We need to implement trauma-informed, culturally responsive care. We have to do the work. I know that DEI and other platforms are starting to be dismantled. At the end of the day, as long as we have persons who are different, then we have diversity. And so we need to look at that. We need to create accountability, and that's what we did. What are we going to do better? How can we do this better? We know that there's something that we need to do. And of course, in all frames of social work and community service, case management, we advocate for systemic policy and changes. So the results that we saw from that was that we had an increase of utilization by BIPOC clients, improved housing outcomes, and created a better trust within our community. Veterans, specifically, in some of these examples, were able to come in who hadn't been seen before. They had been living in encampments for many years, didn't want to come, didn't think that we could help them. They had a bad experience. They didn't want to trust us again. And so when we looked at what we needed to do and actually put ourselves out there to say, hey, we know that we messed up here, or this is an area that we needed to improve on, we were able to change that. People were no longer being identified as unknown. They had a name. They had a proper gender, proper race. Their support systems were built into those assessments better, so that if we needed to get support for them or they had somewhere else to go, that we knew more about them. They were not just a case number. They are individuals who need support. Next slide, please. So other things that we did was community-led resilient models. Again, we cannot do this work alone. When you're working with persons in the community, you don't do this work alone. So we looked at honoring traditional healing practices and cultural strength. And that also included us looking at the services that we were providing in community. We looked at making sure that we worked with corporations. We utilized heavily our peer supports. If many of you work with peer supports in community in your organization, you know how valuable or invaluable they are. We employ people who had the experience of homelessness to help us understand what it may look like from a perspective that we didn't know. It was very impactful. And many times our peer support programs and teams were able to get information that we couldn't get, just because that rapport was there, just because that camaraderie was there. So we're looking at community-led resilience. We're looking at how can we come together to work for the greater good of those who are in need. Community land trusts. First of all, honoring the land that you are on, honoring the land that we are on, and looking at how that affects the communities. Looking to see who owns the land. Are we able to build tiny homes? There's been a massive uptake in tiny homeless communities and populations, where landowners are saying you can use this land to build 15 tiny homes. It gives people land, a space, shelter. These are things that maybe wouldn't have been thought of many years ago. And so these are things that we have to think of outside the box. We talked about this, or I talked about this at the beginning. We can't do this work alone. We need community initiatives. We need those who are going to be able to bring their resources to the table, a resource that I wouldn't have. I don't have land to put tiny homes on, but there may be someone who does. How can we look at putting ourselves in a position to understand and do more? When I was writing my doctoral studies, I wrote on community-led homelessness initiatives. Even then, 5 years ago, That was so very key and important. It was clear that some people had the money and some people had the resources. Others had the time, and others may have had strategic plans. If we continue to work in silos, we won't have a community action plan to help fight homelessness in BIPOC communities and across the board. We will continue to work in silos, meaning that the populations who need us will not be able to get all the services that they need. My goal is to create a uniformed way that we look at homelessness across the board, across all communities, and that we can continue to do that in a way that meets everyone's need. It doesn't make any difference whether you've been homeless one time or 4 times. As long as people continue to show up, we as community leaders need to also put ourselves in a space to understand who, what, when, where, and how. Who should be there? What services are we doing? What community corporations do we need to be talking to? What about peer supports? What mutual aid networks can we use? Is there a pot of money that we can order 15 birth certificates so that we can get those applications down to the housing department? What land can we use? What can we look at to see how we can do this work in a way that meets people's needs? Next slide, please. We can't talk about community. We can't talk about homelessness without talking about our trauma-informed care. And I know many times that can be a catchphrase. We're doing trauma-informed care, but really looking at how we are engaging, and providing care and treatment. We're working on not necessarily what is wrong with people, but what has happened to them. What has happened to them that has caused them to be here? We want to emphasize the cultural, spiritual, and collective healing that people need. We want them to be active in their own care and their own well-being. Yes, many times I've had to make decisions for a veteran or someone, they may not have been in the room. I try to avoid that because we want them to be engaged in their own well-being. We need to address these root causes through political awarenesses. Many times what happens in our organizations and community obviously is politically driven. It's because of healthcare policies or bills or other things that are coming up. We need to make sure that we understand that these are the things that continue to keep people oppressed if we are not looking at their well-being, if we are not addressing their care from a cultural and spiritual and a collective way. If we are viewing people and just taking care of their things and then they don't know what's going on, we continue to create barriers, and we don't want to do that. And so this approach is particularly relevant when working with people who are homeless because they have ongoing racial trauma. They have ongoing historic trauma. They may come from a family who has been chronically homeless for many years. In the documentary, you will see children who are in our shelter system. Many of them came from homes. They had to leave their toys. They had to leave their dogs. They had to leave their bicycles. They've had historic trauma. One little boy talks about his teeth falling out. He would like to see the dentist. These are things that are going to carry these children or be part of these children's story for quite some time. We have to look at how we address trauma-informed care. Healing from trauma requires individual support and collective action. It is all of our job. It is all of our job. We are not far removed from the systems in which we help others navigate. And so that is how we need to look at our healing center engagement and working with homeless BIPOC individuals, homeless persons across the board, children, youth, single moms, victims of domestic violence, and other things in our community, LGBTQIA plus community. What services are being refrained or withheld from them? How can we support all these populations equally? We want to create a healing center engagement. Next slide, please. So here is our policy advocacy. I'm going to not linger long here, but our data collection and analysis. And I have some data slides. Some of them are located here, or I also can send them to you. We were able to look at our numbers, look at the things that we were doing. We gathered race specific data, race specific data. And I know that sounds, but we needed to understand who was homeless and what their race was. We need to understand what that means in our community. We need to make sure that those assessments are done properly. We need to make sure that the stakeholders and the community leaders understand that you had 54 African American women that came into your shelter that had also 2.5 children with them. We need to know that. We needed to know exactly who was there. We don't want to guess and estimate, or we guess maybe 40 people came in. We're not really sure. You want to know those numbers. Make sure you get that data. Partner with your organizations and see if maybe they know anyone who may be homeless. There's a lot of research in New York City and other communities now where they were placing social workers in libraries. And what we know about sometimes with our homeless population is that libraries are where people kind of hang out during the day. You have a bathroom, you have Wi-Fi, you can get on the computer. So many of persons who were homeless were hanging out in these locations, and they weren't at the job center, or they maybe weren't at the shelter. And so we wanted to use community engagements. What other organizations are seeing homeless populations who may not be walking through our shelter doors? We have to get out there. Again, we looked at our policies, addressing our policies, implementation of our funding and what that looks like. Many times you may not always be in charge of funding or have access to the funding, but you want to influence the funding. You want to influence the funding. You want to say, we have a need here. We ran out of money. We ran out of bus passes. We ran out of toiletries. You want to make sure. Evaluation and refinement. Continuously, I want to emphasize this. We need to continuously look at what is going on with our strategies. We have to continue to look at that. We have point in times that meet in every January. I've always thought that point in times should be both in January and in July. We should be evaluating our homelessness consistently, not just when it's cold. Summer doesn't change the status of housing. It just changes the temperature. So we need to look at that. If it's cold in January and we're concerned about people being out on the street, we should be equally as concerned about that in July. Equally as concerned about that in July. The time of the year, the day of the year, it doesn't matter. We need to continuously evaluate and refine what we are doing. And I think that's important. I'm hoping that the future will allow us to do point in times in the summer, because again, the time of the year has no difference of that other than the temperature. The situation remains the same. Next slide, please. This is my challenge to each of you. And as I challenge you, I challenge myself. A call to action. For practitioners, organizations, and systems, examine your own biases and practices. I remember when we were first started in this journey of homelessness and working from my own perspective. And I walked into the Job Family Center and said, I'm homeless, I don't have a place to stay. And then she said, what income have you had? I was a student at that time, so I worked a little part-time job, but I worked it in another state, and I no longer had that job. I no longer had that income. My last check was many, 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 many days before I had gotten there. And she was like, well, that income counts, and you should have enough money to take care of yourself. And I was depleted. I didn't know what to do with that information. How can I account for income that I no longer have? How does that play a part in me getting a house to stay today? Someone put me in a hotel and paid for the hotel for me. I'll never forget that kindness. Otherwise, I had nowhere to go. We need to examine what our practices look like from the front door to the key. If we're going to, it's more than that. It's more than just looking at, okay, this is how we start and this is how a person moves through the system. They may not always look like how they look. I'm sure, came into the job center in a suit. People probably didn't even think I was homeless, and I was. We need to make sure that we implement culturally responsive approaches. Advocate within your organization. Start some good trouble. For your organizations or those who run organizations who are on this call, conduct racial equity audits. Don't be scared to look at the data. The data is the power. We know more when we do better. And so we can do better when we have that knowledge there. Conduct the racial equity audits. It can be a lot. It can be an undertaking. If you can't do it alone, see if you can get some peers or colleagues or a consultant to come and help you to say, this is what it looks like. Diversity, leadership, and staff. As best as you can, be as intentional as you can regarding who is sitting at that table, who is working in your organization. Partner with BIPOC-led community organizations. I'm going to change that there and say BIPOC organizations. Connect with every organization that you possibly can. Do what you have to do in order to get the word out there. There are a lot of organizations doing great work. Some of it may not always be known, or you may need some support. Reach your hand across the table and figure out who you need to know. Coming to conferences, going to COC meetings, showing up to town halls may give you what you need. For our systems, reform funding. I'm hoping that that's where we can go. Implement race conscious policies. I'm hoping that's where we can get back to. Create accountability. And I hope that's where we stay, because we need to be accountable to one another. If one person in our community, one child in our community doesn't have housing, does not have food, shelter, and clothing, that is not a they problem. It is a we problem. It says something about us. It says something about community. And that is what we want to change. And so this is the call to action here. I really want to emphasize that because it's important. We navigate many times through our organizations on our own, and we need to reach across the table. We need to reach out and figure out who else is in the room. Where are the other change agents that we possibly can connect with? So this is our call of action. I challenge you here to just do whatever you can in order to make a difference in the space that you can. Next slide, please. On our policy reform for racial equity in housing, obviously our federal level, we need to strengthen our Fair Housing Act. We need to do a lot of work here. I think this slide speaks for itself. And even when I made this presentation, I knew that this work, this slide, what's going on in our community would look different than it does this morning. And it does. It does. But that doesn't mean that the work still isn't there. There are many people still showing up just like you did today, just like how I do every day, that are invested in policy reform. And I believe that as long as we continue to build community together, that we can create these changes. We need to create how we're looking at what we're voting for, what we're talking about in our organizations, how we're going to use funding. If you're getting grants and you're receiving federal level grants, state level grants, what can you do in your policies and procedures to ensure that you can keep some of that funding going? You may need to change the language. You may need to make some changes in spaces of where you normally wouldn't have to do that. But you need to look at that. And doing those audits and looking at that is definitely going to be that. Continue to push the issue. Make sure that your colleagues and peers and community leaders come together. If you're going to show up at a town hall, do it together. If you're going to show up at your city hall, your state, if you're going to come to Advocacy Day, whatever it may be, and your local levels, understand that the population that you serve is not just the population that you serve. I primarily work with veterans. But I would be remiss not to understand what's going on in my community with my non-veterans, because what is going to help with civilians is going to affect veterans and vice versa. I was a civilian that was homeless, and I understood homelessness from that perspective. When I went to the VA, I understood homelessness from the veteran perspective. There are two different perspectives, but the knowledge is still important. It still helps you to understand holistically how, who, and what is at the table, how things are done, what policy is in place that's going to help a civilian that may not help a veteran, and vice versa. We want to, as much as possible, create a uniformed policy reform for racial equity and in housing. Before we close and see if there's any questions in the chat, I just want to say that the work that you do is so very important. If your lived experience is homelessness, I hope that you have found housing and shelter, and that you have someone in community who is supporting you and making sure that you have a safe place to live and stay. If your job is to provide mental health services, I hope that you incorporate that in your practice. People who are coming in who may have insurance may be homeless. We want to make sure that we're looking at how we are doing, what we are doing, and doing that holistically. If you're an educator and you have students who could possibly be homeless, please work with your school board, work within your school setting, see what you can do in order to support youth, support students. What we know in the summertime, which is why point in time, I wish was also in January and July, was because students tend to go hungrier in the summer because they don't have the school setting to help supply food. We should make sure that we're understanding our biases. People are not lazy. People are not always homeless because they are just not wanting to work or they want the system to take care of them. If we want to be honest about it, the system is not taking care of people like that. And so we want to make sure that we use that language that's appropriate. Ask a person about their housing situation. Are you homeless? Are you houseless? Do you have enough time to stay here? How long can you stay here? What needs do you have that we can meet? Next slide, please. These are my references in addition to some others. And I think this session is going to be recorded and you should have a slide deck also. Please feel free to utilize these references, give credit to the authors in their respective work that they have done in that, and making sure that we share that. Next slide, please. This is how you can connect with me. I thank you in advance for those of you who all have joined this session today. Homelessness is very dear to my heart. I know that homelessness is preventable. I know that we can do better in community. And my goal is to continue to do that. I will always continue to speak on behalf of this work and continue to do this work. I hope to partner with you, connect with you, come and talk with you, whatever the case may be. If you have questions, please feel free to email me and reach out. I will make sure that I respond to that. And I thank you for joining with me this morning here in this platform. Thank you so much.
Great. Thank you so much, Dr. Daniels. We don't have any questions in the chat, just someone saying a couple of quotes that you had shared during the meeting and saying that you're dropping bars. But we do have some Q&A questions from before the meeting.
Okay.
But if anybody in meeting wants to ask a question, you can go ahead and raise your hand, or you can put it in the chat and I'm happy to read it out loud. But we'll start with one of the Q&A from before the meeting.
Okay.
So how do you remain hopeful in these trying times and uncertainty?
I saw that question and I was like, oh, that's a hard one. It's hard. It's extremely hard. Um, but I remain hopeful about our platforms and spaces like this, where people are collectively coming together to say that they care, and that I'm not alone in that caring space. It is very hard to stay hopeful because the bigger picture is so large. You feel like you're drowning in all of this systemic oppression. And when I lay in bed at night and recap the day, I think about all of these things. So I use and lean into my networks to help support that hope. And when it's too heavy to lift or very heavy to carry, then I lean in and making sure that I take good self care of myself and making sure that I do the things that I need to do. But it's a day to day. It's hard. I detach from a lot of news when I can to also just keep my mind clear. I'm aware, but I'm not always connected to it so that it doesn't become too heavy for me.
Thank you. Does anybody want to ask a question? You can ask a question by putting it in the chat, or you can come off mute by hitting the little microphone in the bottom left corner that says audio under it. So anybody can ask the question.
Are we good at time, Maddie?
Oh yeah, we're good on time. We have until 10:40 for this session, so about 30 minutes left.
Oh, very good on time then. I am so.
Time. So time for questions if people have them.
If there's anybody that's doing something in their community that they would like to also share, I would love to hear that. Maybe some work that you've done that that would be great for the room. I would appreciate that also because again, there's many experts in this room, and we would love to hear that as well. Yes. Okay. Yes.
I know.
Okay.
I have a question, Dr. Daniels, if nobody else has one quite yet. So one of the things you mentioned, like the new HUD funding announcement that came out, which obviously had a lot of disappointing things in it
Mhm.
around racial equity and how we're serving folks with different immigration statuses. And I know
Mhm.
parts of your presentation really emphasized like we should be collecting this data so that it can be connected to funding decisions. But for me, at least, it sort of feels like it's moving in a bad direction. Like the funding
Mhm.
decisions that are being made as a result of this data are harmful to BIPOC population. So, have you had sort of any reflections or thoughts about how to continue this work in the current moment when there's really such an explicit attack on doing like culturally specific work or work specifically with BIPOC populations?
Yes. I guess the best answer is that for me, like I have to really push down fear because like BIPOC is like a curse word these days, right? Like it has these negative connotations to it. And um even though all the literature and all the things that are coming out are saying um that you shouldn't do it. As a social worker, to the oath that I take to service community, that goes against everything that I stand for. And so that's where I stand in that. When I feel scared, I'm a clinical social worker. That's what I went to school for. That's what I set up to do. And I'm going to continue to do that work. And so that's kind of how I navigate that. I try to, what I realize with the language and the NOFA and all the things that are coming out is that there are many who are going to say, great, we don't have to do this anymore. We can look at this differently. We can discriminate, and that's fine. And I understand that there may be peers that um, are okay with that, who are social work peers. But I stand against that. We stand and take an oath to support BIPOC populations. We stand an oath to serve all, no matter of their race, but especially those who are marginalized in community. And marginalized populations are not always persons who are BIPOC. And so that's kind of where I stand with that. We were talking about the NOFA this morning with some other peers who work in Dayton, Ohio. And it was just, it was very hard to, the pain is real. Like we really, It's very hard. And so we're just trying to stay focused on what it is that we're here to do. And I believe that we will be able to prevail from that and with that and through that. So hopefully that answers your question, Maddie.
Yeah, thank you so much. Do other folks have questions? I thought I saw somebody come off mute earlier.
Yeah, that was me. Can you hear me?
Yes, we can hear you.
No, I didn't have a question. I just wanted to thank Dr. Daniels. It was a wonderful presentation. I didn't get to catch all of it, so hopefully I'll be able to see the replay because yeah, I'm trying to. There's so many great sessions and there's a lot of overlap, so I try to catch a little bit of everything. But thank you for the presentation.
Thank you so much. Thank you. I appreciate everyone for joining in. The conference has been really great. I hope everyone's had a great time here for the conference. This is my actual first year at the conference, but it will not be my last. And so, again, this work, racial equity, racial justice work, I wanted to say this. I didn't say this earlier, but when I started the racial equity, racial justice work for the Department of Veteran Affairs in the National Homeless Program Office, that started in like October of 2023 for me. But the work had been done by many other colleagues and peers prior to that. Adrian Atwater, Corey Johnson, Heather. They had done all of this work, and I just kind of picked it up where they left off. And when the political change happened and we changed presidency, we lost that work, and those programs were stopped. What I feel, and it was a devastating time. So I'm not even getting ready to make that sound like that's different than what it was. But at the end, what I saw was that people continue to show up and ask questions and want support. And that is part of that hope that I still hold on to. This equity work is important. And I know that, again, to your point, Maddie, and others, that it just seems as if we are just going to do away with that. We only talk about racial equity and racial justice, but there are many, 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 many people who are still invested in that and invested in the work beyond that. And so that gives me hope. When I still see week after week, I mean, that was over 10 months ago when that stopped. And I still see week after week people emailing and asking questions and saying, hey, can you look at this? We're still working on this assessment. We're still going to do this work. That is really where I understood that we planted a seed there that I am hoping will continue to grow. I talked to Dr. Lamont Green this morning. He said, I'm hoping that we can get back to where we left off. And I believe that we necessarily haven't left off, but that we've trickled a little bit, but that we can get back up to a better flow in supporting BIPOC populations who are homeless. And so that work was important. When we initially started, we had what were called core teams. These teams were designed to do the work that I talked about today, to look at their sites, to look at the work that they were doing, to look at the assessments that they were doing, to implement a team that was diverse, including a peer support and a person with lived experience, and to then create this core plan that would help to move our progress and stuff forward. We had like 40 when we first started. And by the time we got done with the work and everything shifted this year, we had 141 core plans. So that told me that the data was there, that people were invested in creating a space to create homelessness plans, and that they were going to do that work to make sure that they serve those in community. We talked about a lot of things. In Philadelphia, where some of my colleagues live, in DC, in Iowa. We were all the way up to Alaska, where homelessness looks different there. And so these are things that I've had a privilege to be able to see firsthand and to present today to you in this way, in this work, because it really was an opportunity for me to learn and grow and expand. Evicting the American Dream was solidified essentially to Dayton, but the work that I did within racial equity and racial justice expanded that across the world. And so that is how we were able to absolutely see what that looked like from the perspective of that work. And so I'm hoping that we can get back to racial equity, racial justice work. We're still doing the work many times. We just maybe not calling it that, but definitely as long as we're serving persons who are marginalized, diverse, then that's what we're doing. That's the work that we're doing. Any other questions or anyone else?
Okay. We have one question in the chat. But I'm not sure if it's a question for you as much as something to just pose for the group, so I'll read it out loud. As a newer member in my local COC and governing council and the various committees, the question that I have maybe more so for myself going forward is how do I continue to show up to help improve circumstances and provide resources for those who are continually being marginalized and discriminated against by the very system that should be in place to protect their human rights?
Mm. I like that. I think I would say, and I don't know if it's a question or a comment, but I would say part of that is to continue to show up. When we think about our leadership, which I consider everyone to be a leader, we sometimes can't change that bigger picture. We can influence that one person, one situation at a time. And so bringing awareness and saying out loud in your COC and saying, hey, I've sat through so many COC meetings, and we just had to say, hey, this is for Mr. Smith, right? He's not ID 148.3. He's Mr. Smith, and this is his need. And can we do something differently? What resources can we bring together? That takes many times courage, depending on where you're sitting. And many times when you're doing those things, it can almost make you like a target in a harmful way. Because again, the system should be protecting you as well. And so I believe that just really standing in space and standing in the gap, showing up, and trying to create even just your own network of support systems. Sometimes we have to work within the systems that we are working in and create this other network that helps to support those who are marginalized. Because I believe that these things will continue to happen and maybe get larger. And we still going to need persons who are going to be able to say, hey, this is what we need to do.
We had a quick logistics question come through in the chat about how to receive a copy of the slides. So Dr. Daniels has already provided the slides. If you're on Whova on your desktop and you scroll down to the bottom of your page, you'll see a Google Docs link. That's a copy of the slides. If you are on your phone, you'll have to click into the description, it's called the overview, and it's right under all the buttons in the middle. And at the bottom of the overview, there'll be the session materials. So you already have access to them in the Whova app.
And you can also email me if either of those things don't work. You can email me as well at my email address, and I can also send them to you as well.
Thank you. Other than that, in the chat, I'm just seeing a lot of appreciation for a really great presentation. I'll read one of them out loud. Thank you for offering me some ideas and things to take away, think about, and act on. Your wisdom has been received. So
Thank you so much. I appreciate that.
yeah, thank you, Dr. Daniels. If nobody else has questions, I feel like we could wrap this session up a little bit early. Is that okay with you?
That's okay with me.
All right. Well, thank you, everyone. Oh, MA, are you coming off mute to say bye, or do you have another question?
Yeah, I do have one more question.
Great.
And I want to make sure I word this properly because I know a component of this National Lived Experience Leadership Conference is that we're making sure that expertise is compensated, right? And Dr. Daniels, you have loads of expertise. So what I realized is I have a peer. I'm here in New York City, and actually every week he does a Zoom for an hour where they talk about the topics of this actual session, like racial justice and things like that, as it pertains to homelessness. And I know there's been times where he may have had a guest join in and speak a little bit. So I don't know um, how he does this with these guests, but I guess what I'm trying to ask is, are there ever times where you may pop in on a Zoom or something and speak to a group about the topics that you spoke about today? Because if
Oh yeah,
so, I would.
absolutely. Oh yeah.
Okay. So
Absolutely.
can I give his name is Will Woods? Would like to give him your information and have him reach out to you since he's dealing with these very topics on a weekly basis. Trying to educate and bring awareness to these issues.
Absolutely. Feel free at any time. Yep, absolutely. And if you need my contact information, it should be in the slide deck or in the is it Wahova? Am I saying the app name right? Wahova app. Or you can find on any of my platforms. You can just Google me. But please, yeah, absolutely. No problem at all.
Thank you so much, Dr. Daniels.
Great. And with that, if nobody else has anything to say, I'm going to go ahead and wrap up this session. Thank you all so much for coming. The
Thank
recording.
you.
Yeah, thank you, Dr. Daniels. It was really
Thank you
wonderful.
so much.
A great
Thank
presentation.
you.
Yeah, and the recording should be available in the next couple of days. So I hope everybody has a good rest of your conference experience. Thank you so much.
Thank you. Have a good day. Thank you.
Thank you. Bye now.